Hey, future counselor, if you want to pass your addiction counselor exam, you must understand documentation. In today's video, we'll review types of documentations we're responsible for as addiction counselors, why timely and accurate documentation is important in the counseling process, and we'll review concepts found on many addiction counseling exams so that you're ready and prepared on test day. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide substance use and mental health education and training services. I also help future counselors like you pass your addiction counselor exams. Make sure you're subscribed so you never miss a weekly study video. And now that we're study partners, let's get started. By the end of this lesson, you'll be able to define documentation and explain why it's an essential component of effective addiction counseling practice. We'll discuss the purpose of documentation, the types of records counselors commonly maintain, and the legal and ethical responsibilities associated with clinical records. You'll also learn best practices for creating accurate, objective, and timely documentation that supports client care, continuity of treatment, and professional accountability. And finally, we'll review documentation concepts that commonly appear on addiction counselor licensing and certification exams so you can feel more confident when you're answering your questions. Let's get started by exploring what documentation is and why it plays such an important role in the counseling process. Clinical documentation and record keeping involve creating and maintaining accurate records of the services provided to our clients. These records document important information such as assessments, treatment plans, progress notes, referrals, and discharge summaries. Documentation helps counselors track client progress, communicate important information, and ensure continued care throughout treatment. It also serves as a legal and professional record of the services provided. Accurate and timely documentation is an essential responsibility of addiction counselors because it supports quality client care, protects client welfare, and helps agencies meet legal, ethical, and regulatory requirements. Documentation is important because it creates an accurate record of the services provided to a client. It helps counselors track progress, monitor treatment goals, and make informed decisions throughout the counseling process. Documentation also supports continued care by allowing providers to communicate important information and coordinate services when appropriate. In addition, clinical records help protect our clients' welfare by ensuring that treatment decisions are based on accurate and up-to-date information. And lastly, documentation serves as a legal, ethical, and professional record of services provided. For addiction counselors, maintaining accurate, objective, timely documentation is an essential responsibility that supports quality care and accountability. There are many different types of documentation used throughout the counseling process, and each serves a specific purpose. The process often begins with intake and admission records, which collect basic client information and document the client's entry into treatment. Counselors then complete assessments to gather information about the client's substance use history, strengths, needs, and treatment concerns. Based on this information, treatment plans are developed to outline goals, objectives, and interventions. As counseling services continue, progress notes are used to document sessions, client participation, progress towards goals, and significant clinical observations. Counselors may also complete referral documentation, collateral contact notes, crisis or incident reports, and consent or release information forms when appropriate. And finally, discharge summaries are completed when a client successfully completes treatment, transfers services, or leaves the program. For your addiction counselor exams, remember that each type of documentation serves a different purpose, but all documentation should be accurate, objective, timely, and focused on supporting quality client care. Counselors are expected to follow documentation best practices to ensure records are accurate, useful, and professional. First, documentation should be accurate and objective. Document observable facts and client statements rather than personal opinions or your assumptions. Next, documentation should be completed promptly while information is still fresh and accurate. Counselors should also use clear professional language that can be understood by other providers and other people involved in the client's treatment. Finally, documentation should include relevant clinical information that supports treatment planning, continued care, and client progress. For your addiction counselor exams, remember the phrase, if it wasn't documented, it didn't happen. Documentation should be accurate, objective, timely, and clinically relevant. Even experienced counselors can make documentation mistakes, which is why understanding common documentation errors is so important. One common error is missing information. Incomplete documentation can create gaps in treatment records and make it difficult for other providers to understand the client's progress and needs. Another frequent mistake is using subjective language. Documentation should focus on observable behaviors, client statements, and factual information rather than personal opinions, assumptions, or judgments. For example, instead of writing that a client was lazy or unmotivated, document the specific behaviors that were observed. Late documentation is another concern. Waiting too long to complete records increases the risk of forgetting important information and details. This can affect the accuracy of the client's clinical record. And lastly, counselors must avoid breaches of confidentiality. Client information should only be shared when legally and ethically appropriate and in accordance with agency policies and laws. For your exam, remember that good documentation is accurate, objective, timely, complete, and confidential. Electronic health records, or EHRs, are digital systems used to create, store, manage, and access client health information. Instead of maintaining paper files, counselors and healthcare providers document services electronically within a secure system. EHRs can improve efficiency by making records easier to access, update, and share with authorized providers. They also support continued care by allowing treatment teams to review important client information, treatment plans, progress notes, and referrals in one centralized location. While EHRs offer many benefits, counselors must still follow confidentiality laws, agency policies, and security requirements when accessing or sharing client information. For your addiction exam, remember that EHRs help improve record management, communication, and continued care, but they do not replace the counselor's responsibility to maintain accurate, timely, and confidentiality. Documentation and confidentiality go hand in hand. Addiction counselors are responsible for protecting the privacy of client information and ensuring that records are handled in accordance with legal, ethical, and agency requirements. Client information should only be accessed by authorized individuals and shared when appropriate consent has been obtained or when disclosure is otherwise permitted by law. Before releasing information to another provider, agency, family member, or outside agency, counselors should obtain the appropriate release of information whenever required. Counselors should also follow the principle of sharing only the information that is necessary and relevant to the purpose of the disclosure. Whether records are maintained electronically or on paper, protecting confidentiality remains an essential professional responsibility. As you prepare for your addiction counselor exam, there are several key documentation concepts you should know. First, documentation should always be accurate, objective, and based on observable facts rather than opinions or assumptions. Counselors should document services promptly to ensure records are complete and reliable. You should also understand the importance of confidentiality. Client records must be protected, and information should only be shared when authorized or legally permitted. Questions about documentation often include confidentiality, releases of information, and proper record handling. Another important exam topic is including relevant clinical information. Documentation should support treatment planning, client progress, referrals, and continued care. Records should be clear, professional, and consistent with agency policies and legal requirements. And finally, remember one of the most important documentation principles for the exam is if it isn't documented, it didn't happen. Documentation serves as the official record of services provided and is essential for client care, accountability, and professional practice. Now let's review a few key documentation related terms that you should know. Progress note, a clinical record that documents services provided, client participation, progress towards goals, and significant events during treatment. An example would be after a counseling session, the counselor documents the topics discussed, interventions used, the client's response, and progress towards treatment goals. Release of information. A written authorization signed by the client that permits the counselor or agency to share specific confidential information with designated individuals or organizations. An example, a client signs a release of information allowing the counselor to communicate with their probation officer about treatment attendance and progress. Collateral contact. Communication with individuals or agencies involved in a client's care to gather information or coordinate services. An example, a counselor speaks with a client's case manager to coordinate housing resources after obtaining proper authorization. Objective documentation. Documentation based on observable facts, behaviors, and client statements rather than opinions or assumptions. An example, instead of writing, the client is not motivated, the counselor documents that the client missed 3 scheduled appointments this month. HIPAA, Health Insurance, Portability and Accountability Act, a federal law that protects the privacy and security of an individual's health information and establishes rules for how protected health information may be used, disclosed, and stored. An example, a counselor obtains the client's written authorization before sharing treatment information with a medical provider to ensure compliance with HIPAA privacy requirements. 42 CFR Part 2, a federal confidentiality law that provides additional protections for records related to substance use disorder treatment and restricts the disclosure of identifying information without proper client consent. Example, a substance use counselor receives a request from an employer for information about a client's treatment. The counselor does not release any information because the client has not signed a valid consent form authorizing disclosure under 42 CFR Part 2. Addendum. Additional information added to an existing clinical record without altering the original documentation. Example, a counselor adds clarification to a progress note after realizing important information was omitted. Medical necessity. Documentation demonstrating that services are clinically appropriate and required to address the client's condition. Example, a counselor documents symptoms, functional impairments, and treatment needs to justify ongoing services. Summary. A concise overview of important client information, services provided, progress made, significant events, and recommendations for ongoing care. Example, at discharge, a counselor prepares a summary describing the client's treatment participation, progress towards goals, remaining needs, and recommendations for continued recovery support. Credentials, professional licenses, certifications, degrees, and trainings that demonstrate a counselor has met established standards to provide specific services within their scope of practice. An example, a counselor lists their LPC and LSAP credentials when signing a clinical assessment, indicating they are qualified to provide mental health and substance use treatment. Progress report, a clinical document that summarizes a client's participation, progress towards treatment goals, response to interventions, and current treatment needs over a specific period of time. An example, a counselor completes a progress report indicating the client has attended sessions consistently, reduced substance use, and is making steady progress toward relapse prevention goals while recommending continued treatment. Question 1. A counselor completes a progress note immediately after a counseling session and includes the interventions used, the client's response, and progress towards treatment goals. What is the primary purpose of clinical documentation? A. To create an accurate record of services provided and support continued care. B. To provide a detailed personal opinion about the client's motivation and likelihood of success. C. To ensure every client interaction is documented in the same format regardless of agency requirements. Or D. To create records that focus primarily on billing requirements rather than treatment needs. The correct answer is A. To create an accurate record of services provided and support continued care. A is correct because clinical documentation records services provided, supports treatment planning, tracks progress, and promotes client continued care. B is incorrect because documentation should be objective and based on facts, observations, and client statements rather than the counselor's personal opinions. C is incorrect because documentation formats may vary by agency, setting, or documentation requirements. And D is incorrect. While documentation may support billing, its primary purpose is to support client care and maintain an accurate clinical record. Question 2. A counselor completes a progress note after an individual counseling session. Before placing the note in the client's record, what additional information should be included to meet documentation standards? A. The counselor's opinion regarding the client's likelihood of maintaining recovery. B. The counselor's signature and professional credentials to identify who provided and documented the service. C. A prediction regarding the client's future treatment outcomes and level of motivation. Or D. A detailed summary of every previous counseling session attended by the client. The correct answer is B. The counselor's signature and professional credentials to identify who provided and documented the service. B is correct because clinical documentation should include the counselor's signature and credentials to verify who provided the service and completed the record. A is incorrect because documentation should focus on objective clinical information rather than personal opinions. C is incorrect because documentation should not include speculative predictions about future outcomes. And D is incorrect because progress notes should focus on the current service provided rather than summarizing the entire treatment history. Question 3. A counselor reviews a progress note from the previous day and realizes that an important clinical detail was accidentally omitted from the documentation. What is the most appropriate action? A. Delete the original note and create a new note that includes the missing information. B. Add the missing information as an addendum or correction according to agency policy while preserving the original documentation. C. Wait until the next session and include the omitted information in the client's future progress note. Or D. Ask another counselor to modify the note so the correction does not appear to come from the original author. The correct answer is B. Add the missing information as an addendum or correction according to the agency policy while preserving the original documentation. B is correct because corrections should be made through an addendum or an approved correction process that maintains the integrity of the original documentation. A is incorrect because original documentation should not be deleted or altered in a way that obscures the original record. C is incorrect because delaying the correction may result in an inaccurate clinical record. And D is incorrect because documentation corrections should be completed by the original author and handled accordingly to your agency policy. Question 4. A client arrives for their first appointment at a substance use treatment program. The counselor gathers information about the client's substance use history, mental health concerns, family background, strengths, and treatment needs. What type of documentation is the counselor completing? A. Intake assessment. B. Progress note. C. Discharge summary. Or D. Incident report. The correct answer is A. An intake assessment. A is correct because an assessment is completed at the beginning of treatment to gather information about the client's history, strengths, needs, and presenting concerns. B is incorrect because a progress note documents services provided and client progress during treatment sessions. C is incorrect because a discharge summary is completed when treatment ends and summarizes services, progress, and recommendations. And D is incorrect because an incident report documents unusual events, accidents, safety concerns, and significant incidents. Question 5. A counselor conducts an individual counseling session focused on relapse prevention strategies. After the session, the counselor documents the interventions used, the client's participation, and progress towards treatment goals. What type of documentation is the counselor completing? A. Treatment plan. B. Progress note. C. Intake assessment. Or D. Release of information. The correct answer is B. Progress note. B is correct because progress notes document services provided, interventions used, client participation, progress, and significant clinical observations. A is incorrect because a treatment plan outlines the client's goals, objectives, and interventions, but does not document individual counseling sessions. C is incorrect because an assessment is completed at the beginning of treatment to gather background information and identify treatment needs or the client's diagnosis. And D is incorrect because a release of information authorizes the sharing of confidential client information with specified individuals or organizations. Question 6. A counselor routinely waits several days before completing progress notes because of a busy schedule. During a chart review, the supervisor expresses concern about the practice. Why is timely documentation important? A. If it allows counselors to include more details from multiple sessions in a single note and reduce paperwork. B. It ensures records are accurate, complete, and available to support continued care and clinical decision making. C. It eliminates the need for supervisors to review documentation for accuracy and compliance purposes. Or D. It provides flexibility for counselors to update treatment plans without documenting services immediately after they occur. The correct answer is B. It ensures records are accurate, complete, and available to support continued care and clinical decision making. B is correct because timely documentation helps ensure information is accurate, supports the client's care, and provides an up-to-date clinical record. A is incorrect because combining multiple sessions into one note can reduce accuracy and create documentation concerns. C is incorrect because supervisory review may still be required regardless of when documentation is completed. And D is incorrect because timely documentation is intended to accurately record services when they occur, not delay record keeping. A client successfully completes a substance use treatment program after meeting treatment goals and maintaining sobriety. The counselor prepares documentation that summarizes the client's treatment experience, progress made, services received, and recommendations for continued recovery support. What type of documentation is the counselor completing? A. Discharge summary. B. Progress notes. C. Intake assessment. Or D. Incident report. The correct answer is A. Discharge summary. A is correct because a discharge summary is completed when a client leaves treatment and provides a summary of services, progress, outcomes, and recommendations for ongoing care. B is incorrect because progress notes document individual counseling sessions rather than the overall treatment experience. C is incorrect because an intake assessment is completed at the beginning of treatment to gather information and identify needs. And D is incorrect because an incident report documents unusual events, accidents, or significant occurrences during treatment. Question 8. A counselor speaks with a client's probation officer to coordinate treatment services after obtaining a signed release of information. The counselor documents the conversation, including information discussed and any plans for follow-up. What type of documentation is the counselor completing? A. Progress note. B. Discharge summary. C. Collateral contact note. Or D. Intake assessment. The correct answer is C. Collateral contact note. C is correct because a collateral contact note documents communication with individuals or agencies involved in the client's care, such as probation officers, family members, case managers, physicians, or other providers. A is incorrect because progress notes primarily document counseling sessions and client participation in treatment. B is incorrect because a discharge summary is completed when treatment ends and summarizes services and outcomes. And D is incorrect because an intake assessment is completed at the beginning of treatment to gather client information and identify treatment needs. Question 9. During a group counseling session, a client becomes dizzy, falls to the floor, and requires medical attention. The counselor follows agency procedures and documents the event. What types of documentation should the counselor complete? A. Progress note. B. Collateral contact note. C. Incident report. Or D. Treatment plan. The correct answer is C. Incident report. C is correct because an incident report is used to document unusual events, accidents, injuries, safety concerns, emergencies, or other significant occurrences that happen during treatment. A is incorrect because a progress note documents counseling services, interventions, and client progress rather than unusual events or emergencies. B is incorrect because a collateral contact note documents communication with outside individuals or agencies involved in the client's care. And D is incorrect because a treatment plan outlines treatment goals, objectives, and interventions and is not used to document emergencies. Question 10. A counselor is preparing for a treatment team meeting and reviews a client's assessments, treatment plans, progress notes, referral documentation, releases of information, and discharge planning documents. These documents are all part of the client's A. Incident report, B. Client record, C. Progress note, or D. Treatment plan. The correct answer is B. Client record. B is correct because a client record is the complete collection of documentation related to a client's treatment, including assessments, treatment plans, progress notes, referrals, consent forms, and other clinical documents. A is incorrect because an incident report documents a specific accident, emergency, or unusual event and is only one part of the overall record. C is incorrect because a progress note documents a specific session or service provided and is only one component of the client record. And D is incorrect because a treatment plan outlines goals, objectives, and interventions, but does not contain all documentation related to the client's care. Make sure you're subscribed so you never miss a weekly study video. To support this learning community, make sure you like this video, hype this video, and share it with a study partner. For additional study resources, the link is in the description.